All right, and today I will be talking about the roles that pharmacists can play in enhancing diabetes care for people who fast during Ramadan. I believe the previous speakers and over the course of this conference, the speakers have highlighted, the importance of this education, the importance of medication management during Ramadan for people who intend to fast during this period of time. So let me first start off by summarizing again the challenges faced during Ramadan. And it goes beyond just the disease and medications. While we are concerned about potential glycemic fluctuations, increasing the risk of hypo and hyperglycemia as alluded by the previous speakers, other complications including dehydration, thrombosis, we are also concerned about inappropriate medication titration adjustments, and it could again increase the risk of hypo and hyperglycemia. Challenges also extend to the lifestyle aspect, not only disruptions to sleep pattern, diet, and physical activities, but also the recommendations to increase the frequency of self-monitoring of blood glucose. And these challenges can be more pronounced in Muslim minority countries. And several studies have already reported that patients who wish to fast during Ramadan, they perceive healthcare providers in these Muslim minority countries as not really understanding their needs and culture. And hence, many were reluctant to seek further advice and education from their healthcare providers. And further on, now we are in the midst of COVID-19, and this poses additional set of challenges to people who fast during Ramadan. As we know, social distancing measures, other regulations that restrict mobility by governments have limited social interactions among our community, and these poses significant psychosocial challenges as well, increasing the risk of anxiety, depression, and stress. Studies have also reported that people fear or feel anxious to visit healthcare facilities, and many of them actually avoid visiting healthcare facilities during this period of time. And again, these restricted opportunities for people to seek further advice and education. And also, now we are, in the era of rising social media technology. Information becomes easily accessible, and everyone can just, go online to search for different set of information. But these information might not be reliable and accurate. Some may be misleading. Others may be entirely untrue. So therefore, there's really a need to ensure that our patients receive accurate information. And also, diabetes itself increases risk of infection, and again, also poses an increased risk of developing severe complications if, they are infected with COVID-19. So after summarizing these challenges, I would like to present a few points that pharmacists can be brought into the puzzle to address some of these challenges. I will highlight three key areas that pharmacists can play a vital role in to address some of these challenges that I've described. Review and manage medications, providing education and lifestyle counseling, and serving as a knowledge and information hub. In terms of managing medications, pharmacists can play a collaborative role as part of the entire healthcare team, and the provision of education and serving as an information hub can form a safety net in the community. And subsequently in my speech, I will highlight the roles of community pharmacists in these aspects. But first, let me bring you through a brief transformation of the pharmacy profession. The profession has transformed from essentially a product-based profession to a service-centered profession today. In the early 1900s, pharmacists were mainly engaged in compounding and dispensing of medications. In fact, this role of pharmacists goes on all the way until the 1980s, when pharmacists began to play a more active role in patient counseling and healthcare management. This was known as the pharmaceutical care era, where pharmacists were seen as a healthcare professional taking care of patients' health, involved in medication and disease management. Today, the roles of pharmacists have further evolved. Pharmacists is now being seen as an integral part of the healthcare team, working collaboratively with the primary care team, providing services aimed at promoting health, behavioral changes, lifestyle, and medication management. So the healthcare paradigm has essentially shifted from a more physician-centric model to the multidisciplinary collaborative care model that we see today, involving physicians, nurses, educators, dietitians, and other healthcare stakeholders, basically anchoring on shared decision-making and centering around patients' beliefs, needs, and culture. So in this collaborative care paradigm, pharmacists are really well positioned to complement the healthcare team in managing medication. So by managing medication, I mean to review medications, identify, like, for example, supplements the patients are taking and other health products that might not be aware to the healthcare team, and to perform medication reconciliation and to recommend adjustments of doses during Ramadan. And with the acceleration of technology adoption driven also by the COVID-19 pandemic, these services can potentially be conducted virtually via telepharmacy or telemedicine, as shared by the previous speaker in Malaysia. So I would like to share a recent cohort study that was conducted in Saudi Arabia, which in fact found promising outcomes of a virtual collaborative care clinic in which pharmacists were involved in managing medications and counseling with regular reviews every 1 to 2 weeks. And these were done together with the primary care team comprising of physicians, dietitians, as well as diabetic educators. And in this study, the general characteristics of the participants were similar to many reported studies conducted among people with diabetes. So the collaborative diabetes care involving lifestyle management, education, ordering of laboratory tests coupled with pharmacist involvement has led to a significant improvement in glycemic control over 4 months. So while these studies was not specifically conducted among Muslims who fast during Ramadan, but the positive outcomes highlighted the potential of medication review being conducted via telepharmacy, and also further enhance the evidence that pharmacists involved collaborative care can be effective in managing diabetes for people who fast. The second aspect to ensuring safe fasting during Ramadan is to form a safety net in the community. As we know, most of our patients with diabetes, they reside in the community. And the recent Dar global survey, as shared by the speaker just now, found that the pandemic essentially did not affect Muslims' intention to fast, with up to 90% of them still intend to fast. And coupled with the fact that people would reduce or even avoid visiting healthcare facilities, and many of whom again are residing in the community, it's important to engage the healthcare providers in the community. And in the context of my talk, I'm highlighting the roles of community pharmacists. So community pharmacists are often the first port of call for community-dwelling patients with diabetes and chronic diseases. They are easily accessible. And in many countries and territories, community pharmacists are a trusted source of health information that the public can turn to. Therefore, they really play a central role in providing education, or in fact, to reinforce Ramadan-focused education and also serve as a knowledge and information hub. So the Dar practical guidelines has emphasized on the importance of Ramadan-focused education, from risk quantification, addressing of misconceptions, lifestyle modifications, medication adjustments to hypo and hyperglycemia management. So community pharmacists residing in the community, they can easily build a strong rapport with patients. Also serve as an avenue to further reinforce the education and for patients to turn to, during Ramadan. So there were, several studies that showed positive outcomes of community pharmacists' educational intervention on not just glycemic control and clinical outcomes, but also diabetes knowledge. Furthermore, the roles of community pharmacists around the globe have also evolved and transformed to one that focus a lot on active patient care as well as health management. And in Singapore, we found that frequent engagements with community pharmacists were found to sort of improve mental well-being. And this cohort study that we have conducted in Singapore found that health education not only improved the clinical outcomes like glycemic control, but also mental well-being. And this further supports the engagement of community pharmacists, especially during this COVID-19 pandemic that poses significant mental health risks. Another aspect that community pharmacists can play a critical role in is to serve as a knowledge and information hub, not only as an avenue for patients to seek knowledge on health and medications, but also importantly to promote accurate information. As I talk about the advent of technology and rise of social media, there are a lot of information out there, easily accessible. Again, this information can lead to anxiety, resulting in detrimental effects not only on the mental health, but also on physical health. And furthermore, as we are maneuvering through the pandemic, it is rather volatile, with changing regularly, especially to the mental well-being. So therefore, community pharmacists can be a go-to reliable source for education and information. So with this, I've highlighted 3 key areas that pharmacists are really needed as part of the healthcare team in managing diabetes for people who fast during Ramadan, especially during this COVID-19 pandemic. But I would also want to highlight that research involving pharmacy and people who fast during Ramadan remains really scarce and limited, especially in Muslim minority countries and territories, not just here in Singapore, but also in the European countries as well. So in order to advance diabetes care, research is really vital. We need to assess the roles of pharmacists in managing diabetes for people who fast during Ramadan, as well as the outcomes of these services, exploring and assessing patients' perceptions and acceptance, and also to identify, enablers and barriers to the implementations, for example, like telepharmacy, telemedicine, or even just any, pharmacist services. And this is especially critical that I observe in Muslim minority countries, where already some studies have reported that, patients have this perception that their healthcare providers do not understand their specific needs and culture. And this could really hinder the effectiveness of such services. And also, there are studies that reported pharmacists lacking, knowledge with regards to diabetes management during Ramadan as well. So therefore, I would like to emphasize again that research is really needed to address this deficit. And at this moment, it is rather limited. So I'm calling for more research in this domain so as to further transform the roles of pharmacists and to enhance diabetes care. So beyond these 3 areas that pharmacists can play a critical role in, I see that pharmacists' role can potentially be further expanded into vaccine advocacy, education, and administration. In fact, there are pharmacists involved in vaccine administration, advocacy, and education in some countries around the globe. And pharmacists, again, should leverage on the enabling power of technology to advance pharmaceutical care. So to end off, COVID-19 has really posed significant challenges to our healthcare systems and further added another set of challenges to people with diabetes who fast during Ramadan. So concerted global efforts to adopt best practices, utilize practical guidelines, engage with international organizations such as the International Pharmaceutical Federations are really essential to maneuvering through the COVID-19 pandemic and be prepared for future pandemics. With this, let me end off with this quote. He who has health has hope, and he who has hope has everything. Thank you very much.